So in MURANO trial, which is kind of now maybe you would say an older trial, where we showed for the first time that a fixed duration treatment without any chemotherapy is actually beneficial with improved progression-free and also overall survival. Last year we presented 5-year updates, and we have this year 2 posters. Because of the MURANO study is one of the older studies and has a lot of rich translational data in it, I think it's also still very valid to discuss those also for all the new trials that are running. So one of the posters that I will present is about clonal regrowth. And the big question, of course, always is, so if you have a deeper MRD, or if you have a new therapy with very good responses, does the therapy itself also influence the biological behavior of the disease? So meaning after stopping the disease, will the disease behave exactly the same whatever you do, or do you actually change that? And the poster that to discuss first, so what I present, is talking about measuring the growth dynamics of the clone after treatment. And what we see is that indeed after chemo-free treatment with venetoclax and rituximab, the clonal growth rate is significantly longer than the treatment with chemoimmunotherapy, where it was in this case Bendamustine and rituximab, showing really that you change the biology behavior of the disease, not only by the depth of response but also by the return of the clone, let's say. So the second MURANO poster was where we tried to look into the reasons why patients actually relapse after treatment. And of course it's fixed duration, so patients stop treatment, then the disease re-emerged. And we have collected cells from the periods, and we can compare now baseline, so prior to treatment in this relapsed refractory group, and what happened if the disease came back. And what we found was some interesting genes that came up, which were related to apoptosis regulation. Some of them were in the clone itself, but we also found ones that maybe are not into the clones. What it really means is still a bit puzzling, because we have so long progression-free survival data now, but also very good ones. We still need to wait a bit more to really see a pattern there, but we do see some novel, maybe mutations or shifts in expression levels of mostly anti-apoptotic regulators.